Still thinking, oh, are they acting differently than when I went into this machine?
Right. No, it's a normal thought process, and we do our best to kind of try to, people to handle that better and to move forward and live their quality of life.
Exactly.
But in some instances, though, what I've also noticed is it's okay to be a bit attentive to your diagnosis and disease, because remember one thing is that standard oncology medicine doesn't address the underlying causes of cancer. They more treat the disease, And so we don't know what those things are. We're realizing in research a lot of core fundamental things can impact the disease. So in some ways, by thinking about cancer a bit in the back of the brain, kind of makes you think, I don't really feel like moving today, but maybe I'll go for that walk,
Sure.
because of that C word that was in the back of my mind. Maybe I'm not going to have like 3 steaks this week. Maybe I'll just have the one and have more fish this time around. And so in some ways, it's not always a negative thing, but at the same time, you obviously don't want to have anxiety attacks. You want to sleep well and have good relationships with your friends and family.
Early prevention, how much can they tell us about early prevention?
Yeah, well, obviously we know, like the classic saying, was that an ounce of prevention is a pound of cure, right?
Sure.
And so, and again, we're realizing, some standard things are important. But one thing I want to bring up too is with screening. In my practice, because I see cancer every day, I do notice certain cancers that get missed a lot, and the one that comes a lot is also colon cancer. So I always say people from a screening prevention, go get your little stool test with those little cards done. Everyone should get them done. If you reach like say 50, get that colonoscopy done, so that's one that I like to talk about.
It's so important, and as you know, it's not that tough. No. I don't know if you've had one, Dr. Lemmo.
Not yet.
Not yet, you're too young.
But I'll tell you.
Well, I have, and it's not nearly as bad as people think it will be.
No.
It's pretty easy.
Yeah. Well, I think when you look at the grand scheme, when you're catching things early, it's a hell of a lot better than say when something's a bit more advanced, in general.
Sure. Well, I know about the mole check. You're supposed to check moles, and now we can go on the internet and see a mole and go, okay, that mole's okay, this one looks a little iffy, do that, do that. What do you think it is about humans who ignore? Like if something changes in your body, and we're really good at it, as you know, something changes in your body, and one day you wake up and you're dizzy, and then you're dizzy all week, and you think, well, I'm just dizzy.
Well, I think there's this variable of, I think a lot of us can get dizzy for many, many reasons. So it doesn't necessarily mean cancer. So like that's number one,
well, that's
right?
Good, I'm sometimes
so,
dizzy.
So keep that in mind, right? It's
yes.
But there's also a perspective of things of unknown and fears. People don't want to know. What else is underlying these things? And so what people don't realize, it's always good if there's something not right, to get checked out, get screened, and rule things out.
Sure, exactly.
Rule it out.
Is just
rule it out.
A check away.
Yeah.
Female cancers, male cancers. Men get more, I think, colorectal cancer. Prostate cancer, of course, because we don't have one.
That's right.
Yeah. And
colorectals too. Yeah.
Yeah, but more colorectal cancer in the males, right?
I believe so, yeah.
Prostate, I think I read that.
Yeah.
Breast, obviously, female.
Females.
But men can get breast cancer.
Yes, they can, yeah.
Right?
But rare.
Yes. So how do you help people recover from treatment in a naturopathic way?
Well,
you're going through radiation, you're going through chemo.
Well, I think what you do is that you first got to tailor a program that they all resonate with too, right?
Right.
So some people, want to be more conservative in their approaches, and some people, they want to go that bit of an extreme. There's also a lot of controversies out there, like when you do, research on an area. But so what we always try to do is remember fundamental things. So basics are you sleeping okay? Are you in any pain? Are you eating okay? Let's try to maybe help you with, like, if you're doing some surgeries or recovering from surgeries, we'll support you in that direction. Say people are doing radiation, what can we do to help you there? So we know physical activity is important. We know acupuncture can help with side effects and that kind of world.
Right.
Then there's like dietary recommendations you can make. There's a whole spectrum of things that you could do. For those that are wanting a bit more, there's even like injectable treatments, IV treatments. There's a whole slew of things. But at the end of the day, you got to give a treatment that they're not too stressed about, because if you're going to be doing something that you're like, I'm not too sure if I'm comfortable with this, or my oncologist says I'm not too sure, that's not good. It rattles you up and it kind of defeats the purpose. We're trying to keep you supported all the way. So in essence, it's kind of like there's some core things, but the key of a doctor like myself is to home it in for you. You know?
Exactly.
Yeah.
Individual, individual, individual.
Absolutely.
Personality medicine. I like that. I think it's the future of medicine. However, if you've been a healthy Sally all your life, and your oncologist says to you, here's the treatment, you have to have chemo, and you think, mustard gas or whatever it is in this perfect body? I don't think so. It's very difficult.
Yes. You know, it is a challenging subject area, but remember one thing, is that, remember that cancer didn't grow overnight. You know, it's a process that's taken many, many years. And sometimes the natural things, while they can impact you in some level, they're not maybe strong enough or deep enough to kind of go a bit further. You know, that's the value of like standard drugs. The body's like, well, what the heck is this? You know, so it can impact the disease and also a bit of you in some capacity. So that's the value of standard treatment. But the great thing is that by incorporating these models together, right, you can actually see, you know, this mustard gas thing that you mentioned, I don't like it, but you know, it can have a value, but doing the naturopathic way can support me through that, make that mustard gas not so hard on you, and help you to recover along the road. But the value to always bring up is this. We're all unique. We're all born with a certain deck of cards. Some people do everything right and they get diseases, you know, and some, you know, have really lucky hands all the way through. It's the nature of it, right?
I hear we're going to die.
Yes, we're all in it.
Really?
We all are.
One day we're all going to do it.
That's right.
That fear of death, if you can take that away, that's a good one too. And that's tough. You have to do a lot of work on yourself to say, whatever happens, I'm totally okay.
It's a process, right? And it's good to dispel some of those things too.
Now, in the system, as an integrative medicine doctor, accepted more today than ever before, it seems to be.
Yes. I think what's happening is that you're seeing a lot of statistics confirming these kind of fundamental basic things.
Right.
And so we know that also people are embracing this world, you know, and they're wanting to find doctors who can support them along that way. Like I remember when the stats were coming out, I think with people with a cancer diagnosis, 60–70% could be doing some holistic approach, you know, without the guidance of nobody. So I think what we're seeing now is the research is there to back things, and we're going to see more of a fusion of the two worlds. And what I'm seeing in clinical practice, because I'm in the trenches, that, you know, when you do an integrative model, the standard statistics widen in terms of response. You know, so if someone was told, oh, there's only a 6% chance this is going to work with their type of disease, I've noticed that, you know, that 6% goes hell of a lot bigger of a number with an integrative model.
Sure, because no matter what life hits you with, you want to beat the odds.
Absolutely.
So you say, I'll do anything it takes to beat the odds, and if that means swirling beet juice and taking flower drops and energy medicine and chemo and radiation and surgery, I'm there.
Yeah, you're there, but not everyone's there. You know, like some people are kind of, they don't want to go to those kind of, those areas, you know, and some people like, give me the kitchen sink and more, you know, and so the key is trying to kind of minimize the confusion and the whirlwind that they're in, and trying to create a center of calmness, you know, so that we can objectively go through what helps, what may not help, what's kind of practical. Some things are expensive, some things are cheap, and you have to kind of do something that people can do for long term.
Right, and you have to weed out the quacky stuff. You do, because anybody who's had a cancer diagnosis knows all your friends come out of the woodwork with just about a suitcase full of, you should buy this machine or move to Mexico or go to Germany.
Yeah, well, you know how I look at that when people offer those things? It comes from a place of caring.
Of course.
You know, so you know what I tell my patients? Bring it in, accept it, maybe you want to discuss it with me, put it in the cupboard, and just say thank you.
Well, and you don't change your personality when you get a cancer diagnosis. I had a friend, she didn't make it, but we went to her with like wheatgrass and all these cures, and she just said no.
Yeah.
And it's not because of that. She didn't do it before, and she wasn't going to start now, and she had a lovely steak dinner.
Right.
Nice to see you again.
No, it's my pleasure.
Thank you. Cancer Center for Integrative Healing.
Inspire Health.
Inspire Health.
Yeah, that's what they changed the name from.
Oh, they did.
Yeah, years ago, and now it's Inspire Health.
Inspire Health. Yeah. I like that. Okay. Dr. Walter Lemmo. And coming up, how to keep a ballet company alive, on point, and on budget. Charismatic choreographer John Elaine joins us next.